name is Jessica Linger, and I'm going to provide you with a brief overview of AIM 1 of the Healthy Vets Project. AIM 1 focuses on enhancing resource registries to improve their relevance, availability, and accessibility for veterans and their families. By evaluating current registries and identifying gaps, our goal is to provide a guide that can be used to improve existing resource registries. We have started to define and list the unique needs of veterans to help us communicate what resources should be included in existing registries. We have also submitted an application to UNC's Institutional Review Board to seek permission to conduct interviews with key partners. This will help us understand how existing registries are being used and by whom. In the upcoming weeks, we will interview individuals from various user groups to gather insights on how they interact with existing registries. We want to understand what they are searching for, how they interpret the available information, and any challenges they face. We will also do this by embedding an AI bot into our website that can answer everyday questions and guide veterans and veteran-serving organizations to relevant resources based on the data we have collected and programmed into the bot. This will help identify gaps in resource availability, access points, and user needs. You can find more information on the Healthy Vets website. Thank you.
A brief overview of the work we've been doing to map social determinants of health and the community conditions that impact the health of veterans in North Carolina. We'll share our progress on deliverables and next steps for our work. My name is John Wallace, and I'm the co-PI managing the work for AIM 2. As a reminder, the work of AIM 2 will visualize community conditions specific to the veterans in North Carolina by looking at where they live relative to necessary supports to distinguish patterns in how resources are organized across people and places, which will identify gaps in community infrastructure and services in order to highlight strengths and opportunities to create veteran-healthy communities. Functionally, this work aims to use a data-informed approach to identify service improvements that lead to veteran-healthy communities. In terms of the progress so far on our work, we've spent the majority of our time identifying and pulling community conditions data. Through our experience, we know that it can be extremely overwhelming to engage with what we call a kitchen sink approach to mapping where any and all available data are presented. Instead, we've been having dedicated strategy sessions to review and refine a sufficient set of community conditions and service utilization data to incorporate into our maps. We're now reviewing our data and maps to compile into a single web-based tool for ease of use. As we move forward in our work, we'll be making a dedicated push to pull the service provider data available and add these data to our community maps. The individual data provide additional context to the service needs, referrals, and connections across communities in North Carolina. We're happy to address any questions and feedback in our work, and we can be reached at the project email provided below.
Hi, my name is Kristen Hass-Miller-Lynch. I want to update you on AIM 3. So we're interested in gathering stories and evidence about how communities can better support veteran wellness. We're creating an interactive website that defines an ideal community wellness ecosystem, shares best practices, and builds the case for change. We've begun to prototype these tools, building from a lit review on community factors that affect veteran wellness. Specifically, we are identifying policies, services, system-wide practices, and concrete resources that really matter most to veterans. We are placing each of these system supports into an interactive web map by vital condition. And we're beginning to use cause loop diagramming to integrate evidence and veteran stories about what matters most. For example, stressful conditions of service impact PTSD, moral injury, service-related stressors that ultimately impact veterans' mental health. Veterans' mental health has a huge impact on their ability to work, their financial stability. And that can be a vicious spiral if we don't work to try to address all of these issues in community. So currently, we are updating our ecosystem map. We're going to begin layering in additional resources coming from the Vital Conditions Framework and conducting interviews with veterans and experts in how to support them to layer in additional sources and rich stories and update our maps. We look forward to sharing updates in the future.
AIM 4, the implementation strategy for building veteran healthy communities. The AIM 4 overview is that what we're trying to do is to bring together around a shared mission of increasing veteran wellness by informing communities of proven strategies and approaches, facilitating processes to prioritize action and agree on which methods to employ, and ensuring that community organizations and entire communities are formally recognized for their part in building veteran-healthy communities. Currently, we are working on two pieces of this within AIM4. One, to create pathways for community action and engagement, which pulls forward some of the lessons that we learned in phase 1 of the project, and then developing an implementation plan and guide, looking at different implementation models that are scalable and sustainable so that all aspects of this project can be disseminated and implemented across North Carolina. Future steps include building a train the trainers curriculum and developing a community recognition and designation program, which will in which we will identify alternative models for recognizing community action and develop sample metrics. Thank you very much.